Today, we're diving into the fascinating world of the muscular system, drawing our insights from Professor Vanessa's comprehensive lecture presentation. We'll explore how skeletal muscles are organized, how they generate power and movement, and even how their names give us clues about their location or function. Let's begin by looking at fascicle arrangement, which significantly impacts a muscle's power, range, and speed of movement. Skeletal muscle fibers themselves form bundles we call fascicles. Muscles are classified into four main types based on how these fascicles are arranged. First, we have parallel muscles. Their fascicles run parallel to the muscle's long axis. These can be flat or spindle-shaped with a central body often called a belly. When they contract, an entire parallel muscle can shorten by about 30%. Good examples are the rectus abdominis, which helps with core strength, and the biceps brachii in your arm. Next are convergent muscles. Here, muscle fascicles spread out over a broad area on one side, then come together or converge at a single attachment site on the other. This attachment might be a tendon, an aponeurosis, or a raphe, which is a slender band of collagen fibers. The key with convergent muscles is that their fibers can pull in many different directions, offering versatility in movement. Your pectoralis muscles in the chest are a great example of this type. Then we encounter pennate muscles. In these muscles, the fascicles form a common angle with the tendon. Compared to parallel muscles, pennate muscles don't move their tendons quite as far, but they contain more myofibrils, which means they can develop significantly more tension. There are three subtypes here. Unipennate muscles have all their fascicles on the same side of the tendon, like the extensor digitorum in your forearm. Bipennate muscles have fascicles on both sides of a central tendon, such as the rectus femoris in your thigh. Finally, multipennate muscles are those where the tendon actually branches within the muscle itself, a characteristic seen in your deltoid muscle in the shoulder. The last type is circular muscles, also known as sphincters. Their fascicles are arranged concentrically around an opening. These muscles surround body openings and hollow organs, effectively acting as valves, especially in your digestive and urinary tracts. When they contract, they make the diameter of the opening smaller. The orbicularis oris, which controls your mouth, is a perfect illustration of a circular muscle. Now let's shift our focus to how muscles use levers to create movement. Almost all skeletal muscles attach to bones, and the point of connection greatly influences the force, speed, and range of motion. A lever is a rigid structure that moves on a fixed point called a fulcrum. This lever moves when muscles apply a pressure, known as applied force, to overcome a load. In our bodies, bones act as levers, joints serve as fulcrums, and muscles provide the applied force. Levers are quite remarkable because they can change several aspects of movement. They can alter the direction of the applied force, the distance and speed produced by that force, and even its effective strength. We classify levers into three types, based on the relative positions of the applied force, the fulcrum, and the load. A first-class lever has the fulcrum positioned between the applied force and the load. Think of it like using a pry bar. In your body, extending your neck and lifting your head is an example of a first-class lever at work. Second-class levers are structured with the load lying between the applied force and the fulcrum, similar to a wheelbarrow. These levers allow a small force to move a much larger weight. An excellent bodily example is ankle extension or plantar flexion, performed by your calf muscles. Most commonly found in the body are third-class levers. Here, the applied force is located between the load and the fulcrum, much like a pair of tongs. While these levers maximize speed and distance traveled, they do so at the expense of effective force. Elbow flexion by your biceps brachii is a classic example of a third-class lever. To understand muscle actions, we need to talk about origins and insertions.
The origin is the fixed, less movable point of attachment of a muscle to a bone. The insertion is the more movable point of attachment. Generally, the origin is proximal to the insertion. An action is the specific movement produced when a muscle contracts, such as adduction, elevation, or pronation. These actions are described in terms of their effect on a bone or a joint. For instance, we can refer to the flexion of the forearm or flexion at the elbow. Muscles rarely work in isolation. They interact in groups to maximize efficiency. Smaller muscles often reach their maximum tension first, then the larger primary muscles increase tension to complete the movement. We identify 4 functional types of muscles. An agonist, or prime mover, is the main muscle responsible for producing a particular movement. An antagonist opposes the movement of the agonist. A synergist is a smaller muscle that assists the agonist. Lastly, a fixator is a type of synergist that helps an agonist by preventing movement at another joint, stabilizing the origin. This leads us to the concept of muscle opposition. Agonists and antagonists almost always work in pairs. When one contracts, the other stretches or undergoes an eccentric contraction. We see this dynamic between flexors and extensors, and abductors and adductors.
With approximately 700 skeletal muscles in the human body, their names can seem daunting. However, knowing the patterns behind muscle naming can greatly help us identify their location, appearance, or function. Muscle names often include descriptive information about various characteristics. Some names indicate the region of the body, like temporalis for the temple or brachial for the arm. Other terms point to the position, direction, or fascicle arrangement. For example, externus or superficialis refers to muscles visible at the body surface, while internus or profundus refers to deeper muscles. Transversus means it runs across the longitudinal axis, and rectus indicates a straight muscle running along the longitudinal axis. Structural characteristics also play a big role. Sometimes the name indicates the origin and insertion. For instance, genioglossus gives us clues about its attachments. The number of tendons at the origin can also be part of the name, like biceps for 2 heads, triceps for 3, or quadriceps for 4. Muscle shape is another descriptive feature. Deltoid means triangle-shaped, orbicularis means circular, and rhomboidal means parallelogram-shaped. We also have terms for size and other striking features. Brevis means short, longest means long, magnus means large, minimus means smallest. Finally, many muscle names tell us about their general actions. An abductor moves something away from a midline, while an adductor moves it toward the midline. A depressor lowers a structure, and a levator raises it. Flexor indicates a bending movement, and extensor a straightening movement. Some names are even more unique, like buccinator for a trumpeter muscle, or risorius for a laughing muscle. The muscular system is broadly divided into 2 main groups. Axial muscles position the axial skeleton and make up about 60% of your skeletal muscles. They help move your head and vertebral column, move the rib cage, and form the pelvic floor. Appendicular muscles, on the other hand, support and move the appendicular skeleton, which means they move and support your pectoral and pelvic girdles and your limbs. Let's delve into the principal axial muscles, grouped by location and function. In the head and neck, we find muscles of facial expression, such as the orbicularis oris, which purses your lips, and the buccinator, which compresses your cheeks. The occipitofrontalis has 2 bellies. The frontal belly raises your eyebrows, while the occipital belly tenses and retracts your scalp. The orbicularis oculi closes your eyes, and the levator palpebrae superioris elevates your upper eyelids. We also have extrinsic eye muscles, or oculomotor muscles, which move the eye. These include the inferior, medial, superior, and lateral rectus muscles, along with the inferior and superior oblique muscles, allowing for a wide range of eye movements. Muscles of mastication or chewing, like the masseter and temporalis, elevate the mandible. The pterygoid muscles help with elevation, depression, protraction, and side-to-side movements of the mandible.
Muscles of the tongue, such as the genioglossus and hyoglossus, maneuver food and are crucial for speech. The pharyngeal constrictor muscles help move food into the esophagus, while palatal muscles elevate the soft palate. In the anterior neck, muscles like the digastric and mylohyoid control the position of the larynx and elevate the floor of the mouth. The sternocleidomastoid muscle, when both sides contract, flexes the neck, and when one contracts, it rotates the head. Moving to the vertebral column, we have the erector spinae muscles, which together extend the vertebral column and head, and individually flex the vertebral column laterally. This group includes superficial layers like the spinalis, longissimus, and iliocostalis groups, as well as deeper muscles like the semispinalis group. Spinal flexors, such as the longus capitis and longus colli, flex and rotate the neck, and the quadratus lumborum helps flex the vertebral column laterally. The rectus abdominis is famously divided longitudinally by the linea alba and transversely by tendinous inscriptions, forming what we often call abs. Finally, the diaphragm is a crucial axial muscle, dividing the thoracic and abdominopelvic cavities. It's the major muscle used in breathing, expanding the thoracic cavity and compressing the abdomen. We also have muscles of the pelvic floor. These function to support the organs of the pelvic cavity, flex the sacrum and coccyx, and control the movement of materials through the urethra and anus. This region, called the perineum, includes the pelvic diaphragm, external urethral and anal sphincters, and the levator ani. Now, let's explore the appendicular muscles. These muscles position and stabilize the pectoral and pelvic girdles and move your upper and lower limbs. We categorize them into muscles of the shoulders and upper limbs and muscles of the pelvis and lower limbs. Starting with the shoulders and upper limbs, muscles that position the pectoral girdle include the large trapezius, which elevates your clavicle and moves the scapula, and the serratus anterior, which protracts the shoulder. The pectoralis minor also depresses and protracts the shoulder. For moving the arm, the deltoid is a major abductor, also responsible for flexion, extension, and rotation. The rotator cuff muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, are vital for shoulder rotation and stability. The pectoralis major and latissimus dorsi are powerful muscles for flexion, adduction, and rotation of the arm. For movements of the forearm and hand, many muscles originate on the humerus and insert on the forearm and wrist. Notable exceptions are the biceps brachii and the long head of the triceps brachii, which originate on the scapula. The triceps brachii and the anconeus are the principal extensors at the elbow, while the biceps brachii, brachialis, and brachioradialis are key flexors. Muscles like the supinator and pronator teres handle the rotation of your forearm. For wrist movements, you have flexor and extensor carpi muscles, and for the fingers and thumb, extrinsic muscles like the extensor digitorum and flexor digitorum allow for complex movements. Tendons for these muscles are stabilized by the extensor and flexor retinacula at the wrist. Moving to the pelvis and lower limbs, the pelvic girdle is tightly downed to the axial skeleton, allowing little movement. However, the lower limbs themselves are capable of a wide range of motion. Muscles that move the thigh include the gluteal group, gluteus maximus, medius, and minimus, responsible for hip extension, abduction, and rotation.
The adductor group, including muscles like the pectineus and adductor magnus, provide adduction, flexion, and rotation at the hip. The iliopsoas group, comprising the psoas major and iliacus, are powerful hip flexors. For moving the leg, the flexors of the knee include the hamstrings, biceps femoris, semitendinosus, and semimembranosus, along with the sartorius. The extensors of the knee are collectively known as the quadriceps femoris, which includes the rectus femoris and the three vastus muscles. Finally, for the foot and toes, extrinsic muscles originating in the leg provide movements like plantar flexion, such as the gastrocnemius and soleus, which share the calcaneal or Achilles tendon. The tibialis anterior handles dorsiflexion. Extensor digitorum longus and flexor digitorum longus move the toes. Intrinsic muscles, located entirely within the foot, also contribute to toe movement and help maintain the foot's arch.
To conclude, it's essential to understand that the muscular system doesn't operate in isolation. It relies heavily on other body systems. The cardiovascular system delivers oxygen and nutrients and removes carbon dioxide, while the respiratory system responds to the muscle's increased oxygen demand during activity. The integumentary system helps disperse the heat generated by muscle activity, and both the nervous and endocrine systems direct the responses of all these systems, orchestrating coordinated movement and function. Exercise plays a critical role in optimizing these inter-system relationships. Our exploration today, based on Professor Vanessa's detailed lecture, has highlighted the intricate organization and functional diversity of the muscular system, from the smallest fascicle to the largest muscle group, and its indispensable connections to overall body health. If you found this overview helpful, please consider sharing it with someone who might also learn from it.